Hello, my name is Jochen Tunkel and I'm a periodontist and oral surgeon in Bad Oeynhausen in Germany. When the lockdown started, most of the staff felt uncertain and was of course afraid of what might happen, especially working in a dental environment. So the first thing was we started team meeting at least once a week. During these meetings I explained the facts, for example the way of transmitting the disease and the measures we are going to take to protect them. And we discussed the plans we made and made adaptations. I also used the Wuhan numbers to tell them that there's a low risk of getting infected in the dental environment. And so these meetings made the staff feel much better and more confident. We did printouts of images for training to how to use PPE, and we also did printouts about every new information that came into our practice. And we placed these handouts in our office in a special folder so everyone could read this information if there was time for reading. Two of my employees were under special risk because they were pregnant and they were no longer in direct contact. We told them not to have direct contact with the patients anymore, and they were assigned to be in the back office and to work in the back office. We had 5 mothers in our office who had to take care for their children because they couldn't go to school or to kindergarten anymore. And we told them they should come to work as often as they could, but if it was possible, they can stay at home. And nevertheless, they received full salary at the end of the month. One of my employees and I myself, we undertook great efforts to get all the personal protection equipment that was not already available in my office. Staff members were really grateful to be able to work, and I realized that because after the end of the first 3 weeks, 3 of my employees came independently of each other to me and told me that they were happy that they could work with us here in our office, because they were happy that they could work and were not hit by the lockdown, which meant financial problems for them. And they were happy that we explained everything to them, especially how to behave and how to use the protection equipment. And they were happy what we did all for them, beginning with the protection equipment and of course ending with understanding of their private problems.